Hi everyone. Today we have Dr. Beena Muktesh, who is the clinical director at Silverleaf Fertility Center and Motherhood Hospital, Gurgaon. She has an extensive experience spanning 40 years, including 20 years of significant experience in the field of reproductive medicine and IVF. Dr. Beena has served as a visiting consultant both nationally and internationally, and it's impressive to know that she has won several awards, including Medical Excellence Award and Inspiring Gynecologist of North India Award. Welcome Dr. Beena to our show today. We are very happy to have you.
Thank you, Pallavi. Thank you for inviting me to your podcast.
So, these are some of the common questions that a lot of people, a lot of couples who are trying to conceive are curious these days, right? And they have a lot of questions. So, I'm going to ask you some questions and you can share your insights with us.
Sure.
So, the first question that I would like to start with is that what is the percentage of infertility among couples worldwide today?
Yeah, it's about 15% of the whole population suffer from infertility. It's quite a high percentage.
Right. It's quite a high percentage.
Yes.
And would you want to throw some light on why is the infertility so high these days? Has it kind of increased from the past? And why is this happening? Why is this trend of high infertility rates these days?
Yeah, because of many factors. One of them is lifestyle. Lifestyle of the people have changed. They work till late nights, there are no exercise, their diet is very abnormal kind of diet, you can say. They order from outside and they don't exercise, they don't meditate, they don't have time for themselves. They get married quite late in life by the time the eggs are finished. So there are many factors which are affecting the fertility of the couple.
Okay, I see. So all of this is very important to know for the young couple, for the couples today, right? Because because of career or because of the lifestyle, it has really impacted fertility, right? That's what you're saying.
Yeah, it's most of the time people are engaged, they are over ambitious, they
Right.
want to do something in life. So getting married and having children is secondary for them. It's doesn't have a priority because
Right.
they keep delaying. They said still there is time,
Yeah.
but they don't realize the eggs have a lifespan that might finish after some time.
Right. Very good point. Now, another question is that a lot of people think that only females have infertility. Do you think that is a common myth? Or is it that, it is more in women, or is it that both men and women, I mean both males and females have infertility issues, can have?
Yes. Most of the time people think it is because of the female. They say, okay, we have brought our wife, please check her up and tell us what is the problem. But when we tell them you need to do a semen analysis also, they are surprised. Can it be because of us also? Because you should know that 25% of the people suffer because of female, 25% infertility is because of male, 25% is for both, and 25% unexplained. Everything is normal, but still they feel that they are infertile, and we also diagnose them having some kind of fertility issue.
Okay. So it can be in both the partners, right? So it's important to get a checkup for both of them.
Yeah. The checkup cannot be completed just with one partner. It has to be both.
Okay. So moving on to the next question from this, how do we diagnose firstly female infertility and then male infertility?
Yes, for female we have to do a thorough assessment. It has to go from history taking, their past history of any surgery done on them, their age, any other smoking, drinking factor, sedentary lifestyle, this all come in the history. So we evaluate first because of we take the history into consideration, and then we start examining. The most important blood test which we do for them is AMH. AMH is basically a test which will tell what is the baseline fertility for that couple. And besides this, ultrasound, if there is any problem with the ovaries, are they polycystic ovaries, is there any problem in the uterus, or there is any other issue, ultrasound will tell us. And husband semen analysis is also been, that will come in male infertility. So for male we have to do a semen analysis. Semen analysis should be a thorough semen analysis. It should not be just from a lab and they did okay, we have sperms. It has to have a morphology. and morphology also under high microscope, which can be done only in infertility unit. They stain the slide and then they do under high microscope to see whether the morphology of the sperm is okay or not. Many patients come to us who say we are absolutely normal, but when we examine the morphology is less than 1%. That means only 1% of the sperms are normal. You can imagine how are they going to conceive normally. So we need to segregate these people and know what is the morphology of the sperm, which is very important in diagnosing the infertility.
Okay. I think you gave a very good answer to the question that, there's like a process involved in diagnosis, right? And both the couple should approach you, the male and the female, both the partners should equally get themselves tested.
Absolutely. Sometimes what happens, they don't know that ovulation takes place only once in a month, which is that day, and they miss that month.
All these factors are very important. Is there a right age to get a checkup done?
Yes, if the couple is married for 1 year and trying since last 1 year, they should consult a infertility specialist, or if their age is more, suppose their age is 35, then they should consult a specialist even after 6 months of marriage.
Okay. So it depends a lot on the age. So if you are like, let's say you got married late, or let's say you were married but you tried to have a baby late in your life, then also you need to be proactive in consulting, a specialist like you.
Absolutely, not like me, but they can consult any infertility specialist.
I mean, any like
yeah,
you.
Absolutely.
Yeah, right.
See, the thing is, fertility check is very important. If they do a fertility check at any stage, they will know that what is our fertility as on that particular day.
Correct.
Now, there are many people who come to me, they say we are just 32, 33 years, but when I check, their fertility is really low, because it is going down nowadays, and there may be many reasons for that. So they have to come to me just for fertility check. They can go to any infertility specialist just to know what is their fertility status on that particular day.
Right, got it, understood. How are you in your specialization helping couples in diagnosis and then treatment of these infertility issues after it has been diagnosed? Let's say that this couple has so and so issue, right? So you can quote some examples and you can say that, you can tell me how are you doing, how is the process, and how are you diagnosing and solving the issue for the patients?
Yeah, whenever the couple come to us for diagnosis of fertility, or maybe process, knowing what is the process, we take a detailed history. If there is any problem with their childhood, did they have any infection in the childhood, then we take family history. Is there anybody suffering from tuberculosis in the family? What is the age of the couple? How many years they have been trying? Are they smoking or not smoking? What is the, how much are they taking alcohol or not taking? And besides that, what is their lifestyle? So this all come in the history, which plays a very, very important role. Then we do a checkup. What we do a blood test, hormone test for the female, thyroid test, prolactin test, and many other hormones, AMH test, which is very important, we do for them to know what is the reason for their infertility. Then after doing the investigation, we plan the treatment. Depending on the history and investigation and the age of the people, we decide what treatment they will need. There are many people who just need to have a proper timing. Whenever the ovulation takes place, they should have, that they should use that period. Then we tell them whether they need IUI, the fertility is okay and the semen analysis is good and the young and the tubes are open. We can ask them to have IUI also. But if this problem is serious, they are more than 35, their ovarian reserve is less, their AMH is less, the semen has any problem, then of course we tell them to go in for IVF.
I see. So depending on their reports and their test results, you will propose the right treatment for them.
Yeah, absolutely. And besides that, we are giving them a psychological support also, because it is said the pain of infertility is like a cardiac pain. You can imagine how much pain they must be having. First of all, we need to connect with them. We have to give them a psychological support.
Correct.
We have to tell them we are with you.
Yes.
We are in your journey to achieve a parenthood. So that's also very, very important.
Right, indeed. I think parenthood is something that most couples these days aspire, right? And the pain is definitely there if you're trying to conceive and you're not able to conceive for a long time, then it's very painful, as you said, right?
Yeah,
So,
you're absolutely right. When they come to us many a time, they have taken treatment from various places. The first thing they do is right in front of us, sit there and start crying.
right.
So they really need a psychological support and somebody to tell them you are not infertile.
Yes.
It's just a process. You are going on a path. You might get success. Your destination will come one day.
Indeed. So I think you, as an expert in this field, will give them, you will not only guide them, give them the treatment, but you will also give them psychological and mental support to go through this journey with you.
Yes. And meanwhile, we tell them to do exercise, do meditation,
Right.
have a healthy diet. We make a diet chart for them. We guide them to a physiotherapist or maybe an expert who can help them to do some exercises, and teach them to do meditation also, which balances the mind and thus balances the hormones also.
Okay, okay. That is all great, information coming from you. Now, I would like to ask you, how long is this process? Like, for anybody approaching you, they would like this is a general question, right? General curiosity from patients, that how long will it take me to conceive, and if I go through this treatment, how much time does it take?
See, it all depends on couple's age, their history and their assessment of hormones, ultrasound and all. So, maybe we just tell them ovulation time and they conceive next month. Maybe we tell them IUI and they are perfectly fit for IUI. Maybe they conceive in 3 months. But if the problem is more, people age is more, then maybe they have to go for an IVF, then it takes maybe another 6 months to 8 months. People are elderly, more than 35, hardly any eggs seen in the ovary, hardly any follicles seen in the ovary. We even tell them to start the IVF treatment before the eggs vanish from their body. So it's also important to counsel them that IVF is not the last resort. You can have it before also, provided your eggs are still there. And if you keep it for the last, maybe this is a last resort when everything fails and there are no eggs, from where are we going to get the eggs? That's
Correct.
very important.
That's very important indeed. So, you briefly touched on, eggs and, the eggs, the AMH level, and all these technicalities that are involved in the process. Can you explain to our listeners today what is the process that they will go through when they start the IVF till the end?
The most important thing is counseling. People think that IVF is, it's a very, very difficult process. Let me tell you, it is not a difficult process. It's a daycare process. First, we do all investigations and correct whatever is needed for that couple. Then when we start their IVF cycle, we start it from day 2. We stimulate the ovaries by giving injections, which is done every day. Initially for 5-6 days, there's small injection like insulin, small injection, which are given subcutaneously. Then for another 3-4 days, maybe we give them some more intramuscular injections. Once we keep monitoring during that, do some hormone test and monitor follicular monitoring, and we see if we feel that the eggs are mature now, then we try to extract them. Extraction takes place under anesthesia, which is hardly for 15 minutes. Because we have given anesthesia, so we keep them for 4 hours or 5 hours afterwards. When they come down and take discharge ticket from, they come walking and go walking. So it's not like, they will have so much of pain or they will be in distress or there's such a big operation. It's not like this. Once we retrieve the egg, we fertilize it with the husband's sperm, which is done in a very good IVF laboratory. They fertilize and they grow inside the lab only. Then maybe day 3 or day 5, we can transfer back in the uterus, which is not under anesthesia. It's a simple procedure like IUI.
Okay.
They can take medicine afterwards, and 9 days or 12 days later, we come to know about the results.
I see. So it is not extremely painful.
Definitely not. It is not painful. See, the pain which they will label it as pain is the pain of injection.
Okay.
Anybody gets an injection, they have a pain of injection.
bit.
That's all. Egg retrieval or egg removal will take place under anesthesia, which is 10 to 15 minutes only. And that also a very thin needle attached to ultrasound machine. So that's very simple. And when embryo transfer is done, it is not done under anesthesia. So one can understand if it is not done under anesthesia, it must be a simple procedure only.
Right, indeed. So you have busted a lot of myths about IVF, right? So are there any other myths that you think we should be aware of, that people think that IVF babies are not normal babies or something like that? Do you want to talk a little bit about the myths associated with IVF?
See, if you talk about the normal or abnormal baby, they're absolutely normal. If they conceive naturally and if they do an IVF, babies are just alike.
Right.
There is no
No
difference
difference.
in, because of the method or technique, this babies will not be normal. This is the biggest thing.
Biggest myth, right? Yeah.
Another myth is that they think it is always going to be twins. Not necessarily.
Okay.
They may have single. If they opt to go for one embryo transfer, there is going to be one from where the other baby will come. So that is also very important. And there's a big list of myths. If we start talking about, I
Right.
think we can make a separate podcast for all myths and facts about.
Right, there are a lot of myths. I think it also depends on the society, but at least you've busted a lot of myths that it's absolutely normal. Baby is absolutely normal and it should not be treated like this is something very different from a normal pregnancy. It's absolutely like a normal pregnancy.
Absolutely. Nowadays, the drugs are, tolerated by people that there's hardly any pain for injections also. And moreover, if injection 10 days, they consider it as pain, then there is pain. Otherwise, there isn't any pain.
Okay, understood. I think these are all great points. Now, can you tell us a little bit about the success rate of IVF for anybody aspiring to conceive through IVF? What is the success rate for this process?
See, we cannot consider success rate in a broad term,
Okay.
It depends on age of the patient, conditions, underlying disease. Are they suffering from any underlying disease? What is the sperm? There are a lot of things. But still, in a broad term, if you want to ask me, I would say first cycle if they do, success rate is nowadays 60 to 70%. And once, suppose, unfortunately, they fall into 30% or 40% who are not successful, even if we have an embryos, we can just implant those embryos and there may be another 20%. So, in all, there is 90% success rate if they do 3 cycles.
Okay.
And there is a cumulative effect also. If they have done 1 cycle and they do 2nd cycle, there will be cumulative effect. So, like that, success rate is good. But the most important, I would like to tell every couple, don't wait for age to advance. Don't wait for all your eggs to finish and then
Correct.
go for an IVF. If you are not able to conceive by 2 IUI, they should go for an IVF, because then they have good number of eggs and success will be very high.
So I understood. So these are all the things they can do, prior to an IVF treatment. Before, they should be aware of all the next steps that they need to do, like IUI. If they're not successful, then they should approach a specialist like you and talk about IVF treatment, right? They should be proactive in their approach.
Absolutely.
Yeah.
This is a warning and to everybody. We are lacking behind 6 years than our counterparts abroad. Their fertility may last for 40 years, but here in India we see drop in fertility from 34 years onwards. So, in case if they are not able to conceive or they are not able to get any partner, they should at least freeze their eggs so that they get their own biological child when they
Right.
want.
A lot of population is working in corporate jobs these days, and because of the commitments, job commitments or family commitment, they are waiting for the right time to conceive. So for these kind of people who are extremely busy in their work and jobs, do you suggest any particular way that they can still delay their pregnancy?
You were asking me what can they do in case if they have to delay their pregnancy. There are many methods. One is, first they should go for fertility check and see if their fertility is low. Then they should either freeze their eggs. Suppose they are not getting a partner, not ready to have pregnancy now, they can freeze their eggs. Then whenever they want to have pregnancy, they can do their own pregnancy naturally, and then if they don't get pregnant, then they can fall back on the eggs which we have frozen.
Okay. And is it better to go for egg freezing or is it advisable to go for embryo freezing?
The difference between egg freezing and embryo freezing is, if the lady is unmarried, we don't have sperm, then egg freezing is the answer.
Only option.
But if they want to delay pregnancy and they are married because of any reason, job reason, traveling abroad, then they should freeze embryos, because embryo freezing is better than egg freezing.
I see. So these are all great points that you shared with us today, right? And this will be very helpful for our viewers. I would just like to tell the viewers today that we have got so many good insights, and Dr. Beena has shared really interesting facts about IVF, right? So if you want to, for example, delay your pregnancy and you don't know how to approach it, you still need to consult a doctor. But if you think you're already quite delayed in your pregnancy, then you definitely need to consult to understand the process of IVF, to understand the process of all these fertility treatments. So be proactive in your approach, and don't worry, and just feel comfortable to approach doctor like Dr. Beena. She will not only support you emotionally and with her, but also support you really with her treatments, and hopefully you will be able to have a baby soon.
Yes, definitely. Thank you very much for that interesting podcast.
Thank you, Dr. Beena.